Hi everyone. I'm Dr. Krishna Reddy Taduri, consultant endocrinologist, Medicover Hospitals, Madhapur. So I would like to speak about hypoglycemia in diabetic patients. So this is a very worrisome because low sugars will lead to the low sugars at the brain, and which will eventually can, if the symptoms are neglected, it can result in the even seizures and coma and sometimes death also. So this is a very worrisome complications of type 2 diabetes treatment. So you should be knowing about the various symptoms and signs of hypoglycemia and prevent at the early stages to have a better quality of life. So what are the incidences? So if you see the type 2 diabetics which are on oral diabetics with doesn't have any hypoglycemia risk, the risk is very minimal. But you are a type 1 diabetic or on sulfonylurea medications or insulin medications, the risk is very high. So sometimes weekly, one time, 2 episodes, 1 episodes, and they can happen. And especially in type 1 diabetics, the severe hypoglycemia, that is classified as a sugars of less than or equal to 70 with which needs assistance to overcome this hypoglycemia in the form of IV glucose infusions. They may require at least once a year. So this is the burden of hypoglycemia, and the level below 70, it is called as a hypoglycemia. At this point of the time, your brain will send the signals to your body that you are having a low sugar levels. So you should be very attentive to those symptoms like tremors, excessive sweating and palpitations, and sometimes paresthesias and dizziness and excessive hungerness. So these are all the symptoms of hypoglycemia you should not neglect. So any symptoms of hypoglycemia is present, you should immediately check your blood glucose levels, and if it is below or equal to 70 milligram per deciliter, you should immediately consume a carbohydrate meal. So the ideal way of reverting this reverting this hypoglycemia is having a 4 spoons of sugar in 1 glass of water. That can work for you, especially if you are on glucosidase inhibitors like acarbose or oglibose. The sugar won't work for you. In that scenario, specifically you need to use Glucon-D, so which is a simple glucose that should be 4 spoons to be added to 1 glass of water. You should consume immediately. And sometimes we will advise some type 1 diabetic patients or type 2 diabetics with very much increased incidence for the hypoglycemia. We may advise to carry the dextrose tablets along with them, sometimes glucagon injection to revert back this hypoglycemia to the normal glycemia. So, and also some of the medications can cause this type of hypoglycemia, and if you are facing any severe hypoglycemia, you need to change your medications, and you need to adjust your insulin doses and insulin technique, and you need to also check your diet, because certain amount of carbohydrate, certain insulin dose is required. If you consume less food and compared to your insulin dose, and if you are having delay in insulin injection, or if you're having a higher dose of insulin injections, and sometimes the abnormality in your other hormones like cortisol and other hormones can also lead to your hypoglycemia risk. And especially this type 2 diabetic complications like nephropathies and liver failures, they also can lead to hypoglycemias in type 2 diabetics. So you should be very cautious, and you should always check your glucose with your glucometers. Whenever symptoms of hypoglycemia is there, you should be attentive and immediately terminate with the consumption of either sugar or Glucon-D powder. So this hypoglycemia symptoms hypoglycemia can be tackled by some of the medications which having a low risk of hypoglycemia. Especially if you are on insulins, you can change back to GLP-1 receptor analogs which have a low risk of hypoglycemia. And if you are on sulfonylurea drugs, you can switch to other less risk of hypoglycemia agents that can be useful. And you should also have a proper meal and proper diet, because change in the carbohydrate content of your meal also will change in the insulin doses. So you need to know the carbohydrate counting, and based on that you may need to adjust your insulin doses accordingly.